Yes.
Wonderful. Well, thanks for joining us at the webinar to hear more about our One London secure data environment and our call for driver projects. We're recording this so that those who can't make it are able to watch afterwards, or if you've enjoyed it so much you can watch it twice, or however many times you want to watch it. What we're going to do today is spend a little bit of time walking through three different bits of information. We'll try and do this relatively rapidly. We'll take sort of 25-30 minutes and leave the sort of second half of the discussion more open to question and answers. Please feel free to use the chat to set out any questions you've got. We'll collate those, and for you and those who aren't able to join, we will assemble answers to them and make that available back through the One London website and circulate a link around with recording of this webinar. Before we jump in, I'll just say a little bit about who I am and say thank you for joining us today. My name's Mark Hewley. I'm the Programme Director for the London Secure Data Environment, and it's my responsibility and privilege to work on behalf of the partnership across One London. So that's the 5 London ICBs, NHS England as a region, and the universities to try and assemble a coalition of the willing and able to make London the healthiest global city, principally by using data at scale to drive innovation. So I'll be joined in the presentation by Kavita Saravana-Kumar, who is one of our product managers and sort of technical leads for the data service and analytics platform. Kavita will talk a little bit about what data is actually available, and I'll top and tail. I'll cover some of the context to indicate really what we're looking for in terms of the driver projects, and also to talk a little bit about how we want to assess proposals that come in. Want to run through that really so that you all have a clear sense of what we're looking for, but also how, in a sense, to position your responses so that they've got the greatest chance of success. So I'll start with the context, and I'll walk through this relatively simply. But if you have a little look on the right-hand side, this is a pretty simple description of our theory of change. So our overall ambition is to drive at transformation. So this is about making London the healthiest global city. And in order to do that, we've got a strong belief in a theory of change that says we have to assemble the transformation resources we've got. And we've got a lot of highly expert, highly capable transformation resources in London, alongside real world data at scale. Again, we've got lots of elements of this that I'll touch on. And we've got to align those around answering real world health system challenges that we have in London. These are generalizable across the country and globally, so that we generate insight but turn insight into impact. Right? That is what the One London partnership's about. That's what the secure data environment agenda is about. We're driven really by a North Star, which is the regional London vision goal. That's across the NHS, the GLA and London councils, which is unapologetically to make London the world's healthiest global city. To do that, status quo doesn't work. We have to transform how we work, and we've got to attract inward investment and nurture innovation in the regional economy to grow it. Put that together, it means making London the world's most innovative health and care system. And innovation here, I'm using it in a very specific context. That's not just invention, it's implementation and then improvement and adoption at scale. So it's the full spectrum of development into action, so that we can have a system that can offer first a product, first a trial, first a deployment, as I say, with a focus on addressing the things that are going to give a huge dividend for patient benefit, but also offer, pragmatically, a way to grow the economy by being more productive in the health service, but also by then enabling companies that start here to grow here. That's the overall context. The London SDE sits as a core foundational part of that, and the London SDE in the first instance is operating to to provide one of the world's largest linked health records available through a secure governance arrangement where analysts come to the data rather than data going to the analysts. We'll talk in more detail about that when Kavitha speaks, but just to give you a little bit of a sense of how this fits into, in a sense, the wider complementary technology stack, for want of a better word. Our sort of working representation is that years ago we started with healthcare providers as fragments in, or islands in an archipelago, separated without effective ways of sharing information between them. Huge steps have been taken in London to connect that up. The London Care Record, which is a view-only health information exchange, is a core part of making information available in one area, or one care setting, visible in another. So in terms of actually informing care delivery, the London Care Record makes available information and insight to clinicians at the point of care. That's a core part of our technology stack. Added to that is a system level repository, the Universal Care Plan, which holds information and documents available not just to clinical teams but to patients themselves, and it's available to clinicians through a link in the London Care Record. What I'm driving at here is there's a complementarity and an interoperability between parts of the technology stack. And really importantly, the London Secure Data Environment is a core part of that. Imagine it, if you will, as a slightly sophisticated data warehouse for the system that can drive analysis of information to generate insights for direct care, for strategic commissioning, and for research. All of those interrelated, one should feed the other, with useful products and analysis developed in the secure data environment, made available back through the Universal Care Plan or the London Care Record. And building that out further, and we have this as a great example in the Universal Care Plan, where it's available to patients through the NHS app. There should be a way of surfacing information back to patients in that way. And of course, the federated data platform is a huge part of the national, regional and local infrastructure. So all of this works as a complementary whole. When we talk later about routes to impact and considering how insights derived in a secure data environment can be made available to affect change on the ground, what we're really asking is for you to think deliberately about how these combinations of technologies actually turn insight into informed decision making. It's really important as part of this that we're also trying to think about the people side rather than just the sort of processing technology side. And to do this, what we're effectively trying to do is stimulate our own organizational development across a really powerful but fragmented community that operates across this continuum of innovation, from those of you who work on foundational science through to those who are doing improvement science. What we're really noticing is London has a richness of expertise funded through different sources with slightly different focuses, but all of which sit across this continuum in ways that could be, and we hope through this process will be, complementary. If you see the London secure data environment really as being a shared asset that allows data to be available for research projects, but also a way of connecting the community of expertise that sits in these various units to come together, again, to address real world problems by aligning our data and our transformation expertise. This is how we're thinking about the call as a way of mobilizing not just people who work in the units with these acronyms, but mobilizing people across this spectrum to work together in collaboration, not competition, in order to address large scale change. Hope that gives you a sense in terms of the context. We'll come back in a bit more detail around the core elements of an assessment framework. But before we do that, I just want to hand over to Kavitha to say a little more about the current data assets and the platform itself. And Kavitha, feel free to instruct me to move on as and when you're ready.
Thanks, Mark, for driving the slides. And hi, everyone. As Mark introduced me, I'm Kavita Sarvanakumar. I'm one of the product owners. As Mark alluded to, the London Secure Data Environment has two components, the London Data Service and the London Analytics Platform, and I look after the latter. Just for the avoidance of any doubt, I do know a lot of you, in the call, and some of you I don't know. But for those I know, I do have a day job in Northwest London as a Chief Information Officer. But for the purpose of today, I am, taking my London role. So as Mark alluded to, what I want to do was, give you a little bit of an insight to what data will be available so that you can consider that as you put your, prospective applications for this driver project, and also give you a little bit of an insight about what the environment will look like that you will have access to conduct your research. So if I start with the data, we are going to, have a linked data set across London that will be available for you to use. So as Mark said, this will be one of the biggest linked data set, and it will be a broad data covering primary care, acute, mental health, and community. So I've got on the screen here what we would have from each one of these. Primary care data is in effect all coded data from the general practice electronic patient record system one and EMIS, which is used across the general practices in London. We have over 1,000 general practices, and they all capture a lot of data when they see patients. And this will include anything and everything like appointments, diagnostics, prescriptions, and admin activity. So we will not only have the coded activity, we are going to then, run some algorithms on top to create registries of patients with long-term condition, which will align with the quality outcome framework that, some of you may be familiar with. In terms of acute mental health and community, our aim is to use a nationally standard data set that is published by the acute mental health and community providers across London to the national team. And what this will capture is basically all of the activity that has happened in each of the care setting. So in the case of an acute, it will include accident and emergency inpatient and outpatient data. So who has intervened with those services, for what, and have they been admitted, for how long, and what are their diagnostic and procedures they have undertaken during their stay. Likewise, with mental health and community, it's those patients who have interacted with those mental health trusts. Is that in a day case? Is it an inpatient or an outpatient? For what services? So it'll go into that level of detail. There is a spec for it, although I have given a bit of a plain English description. There's a detailed spec if you want to look at it. Mark, if you move to the next slide, which I have given, and I'm sure we will circulate this slide deck as well.
Apologies, I've actually hidden that slide. I can bring it out, but it's
That's fine. So we can share the spec for each one of these data sets, so you can understand what data points will be available. One thing to notice, we do publish the spec of all of this within a metadata catalog that is available on Health Data Research UK. So we can also share the link to that for you to see what data is available. So if you move to the next one then, Mark. Are you going to go straight into the application process? Shall I say something about the platform whilst I am speaking, Mark, before you go to the application then? So on the platform, again, if it's helpful, I can send some information to you, or put it in an FAQ. But what basically you will have access to is a research desktop. You will be accessing a virtual desktop when you get onboarded, and that research desktop has a range of tools that would be accessible to you. Snowflake is basically used as the analytical and data warehousing tool within this environment. So that is what you will be using to access the data. And Snowflake can be accessed through something called SnowSite, and all it is a user interface. So basically, it allows you to connect you to the data via a web application. And we'll be able to onboard you and talk you through all of this, if you had a successful application. The other thing to notice, the environment also has access to machine learning, Azure machine learning, and we have a standard offer for all users, which is the small machine learning instance offered by Microsoft, but that can be scaled up depending on your project, if you want to scale up to a medium, large, extra large, there is different levels to which you can scale up. If you want to scale up in order to drive your project, then no problem at all. We will be able to do that for you. There are some standard, setup within the environment where, the Azure machine learning instance, for example, is configured to shut down, after a specific idle time. And that's just to minimize our costs, right? So we are like constantly looking for opportunities to, optimize our costs. So there is a shutdown, automatically done based on idle time. Um, s- and uh, and finally, I will say we have Jupyter notebooks, which can be accessed, executed, and managed using the Azure Machine Learning Web Service. And RStudio and Python can also be accessed. And we have a range of RStudio packages and Python libraries, which you will be able to see when you access the environment. But if there's a particular package or a library that you want and that's not available, again, no problem at all. You can contact us and then we will make that available for you. There is a process. Um, Again, what we will do, Mark, I suggest, is put some of these things into an FAQ document and share back with people. And I will, in that FAQ document, will also share our generic mailbox so you know who to contact if you have any queries around what data is available or what the platform looks like, etc. I'll stop there, Mark, and hand back to you.
Wonderful. And you very gracefully carried on, recognizing that I'd failed to put your slides up. I've got the right pack now. So what I'll go through the application element and then I'll come back to you, Kavitha, just so you can talk through the slides that you wanted to, so that we can get into the detail of the conversation. But thanks for hiding my blushes and or sparing my blushes, and I'll move on to the application part. Okay, so I think I just want to start really with the core aims of the driver project. So up at the top, just want to reiterate that we're trying through these projects to showcase something about the coordination across the innovation ecosystem, right? So this is not a usual response to a grant proposal to do a specific bit of research. We're trying to exemplify a type of collaborative working that is directed towards a high priority real world problem. That means mobilizing across respondents, multidisciplinary R&D teams, supporting you to access and enhance, come back to the enhancement part, the real world data and analytical tools within the London secure data environment. It builds on what Kavitha has said, but also to work with you to actually establish how insights from that work could credibly affect change in the real world. So this element here of the route to adoption is really important. And if you think about this as being really a way of exemplifying a proper learning health system, what we're trying to do is take insights through data, work with clinicians and academic and innovation teams to understand what's going on, to think about improvement, to adopt that in an iterative and virtuous cycle. So this is really trying to exemplify a way of working as well as undertake high quality research. You'll see that then in the way that we are thinking about assessing responses. And in the first domain, what we really want to see in responses are proposals that can credibly exemplify a collaborative, or in this sense, ecosystem approach, and it being problem directed. What that really means is that you are addressing a practical, tractable and prioritized real world challenge, and that in a sense, the request for funding is to assemble and fund an MDT approach that can work on that across a particular set of geographies. To want to give a sense of then criteria and examples, that really means starting with something like the London Vision and saying we know it is a priority. It is undoubtedly the case that neighbourhood team working needs to be mobilised in London, and there are some high impact challenges that neighbourhood team working is confronted by. That might be particular types of high prevalence long-term condition management or complex long-term condition management, cardiovascular, asthma, certain types of approach to segmentation to deal with different sorts of complexity, or elements to do with a stage shift for cancer diagnosis. But we're really looking for those proposals to be directed towards clear and prioritized real world challenges. To give an example that I know relatively well from Northwest London, what that would mean is, because the ICB has declared 3 major research and innovation missions, we would be expecting those missions to be the galvanizing element of responses from teams in Northwest London. So that would be to do with children and young people's mental health, or cardiovascular management, or right care, right place, right time. That's going to be a core element, and you can see on the right hand side that ways of assessing this would be to say, look, if there's some tangential alignment, then it gets, some points. If it's a core feature of delivering a regional priority, then it gets more. And if it has the ability, if this could exemplify either interrelated priorities, or there's a clear generalizability, it started with something specific but intentionally with wider applicability, then it scores more. In addition to that, I know we're asking a lot, but what we're really hoping these projects will do is demonstrate that these things, these challenges, are well met by having access to the types of data and capabilities in the secure data environment. So that would be, as Kavita said, structured GP data, commissioning data sets for acute community or mental health, and come back later to the slides that Kavita has put together about specifically what sorts of data that includes, or pathology data pipelines that are available currently in Northwest London, but not ubiquitously, or things like federated learning for multimodal radiology that has been deployed in some areas through the AI Centre. Those are the sorts of capabilities that we want to be able to demonstrate. And again, in terms of scoring against that, if we're demonstrating some utility of GP records at scale, it's a good solid tick in the box. If we're looking at the utility of link records, I think that commands more attention. If it can showcase connections across high value data pipelines beyond, in the sense, the core, so things like pathology data sets, then that commands higher credit. Beyond that, and I think relatedly, of course, we're restless, and we don't want to just sit on what we've already started to develop. So we want to actively enhance where possible. There's a balance here between what's feasible and what's desirable. But if there are projects that are bringing focused attention on the curation and engineering of new pipelines that will enhance the overall capabilities in the London secure data environment, that's really something we want to support and encourage. That could be pathology data, or care home data, or social care data for adults and children, IAP data, ONS or registry data. Those are the sorts of things that my suggestion would be to bear in mind the feasibility of actually getting agreement for the use of this data and the ease of curating it. Where we're looking in terms of scoring on this, if you could secure a local data pipeline, again, that's strong tick in the box. If this work would establish a reusable pipeline, so something that is curated for this specific project but can be generalized, then that commands more. And again, if there is a novel capability or high value data asset that comes from beyond health, that would score more. I should say these are additive. So if you just did 3 without 1 and 2, then it wouldn't score as highly. Then the 4th domain here is about creating a sense of collaboration and commitment. So again, I want to say unapologetically, we're not seeking to fund research. We're trying to change the world in a more extensive way by driving at research plus new ways of working and focusing on impacting in practice. So parts of those commitments could be, and you can see the sort of relation between the domains here, that you've got the right partners involved in the proposal making formal commitments through letters of support that say, if you're sourcing a new data source or data set and wanting to develop a data pipeline, you'd have to be able to demonstrate that the data controllers and processors are on board with that you've spoken to them, that you've lined them up. that teams that are vital to the effective sort of design and implementation of pathway change are also involved in the proposal, and that you've given some consideration by engaging with teams involved in the rest of that technology stack to think about routes to impact. So I know a number of you have already started to have sort of thoughts about how artifacts or analytic outputs from an SDE could be connected into something like an output in the London Care Record or the Universal Care Plan. So again, criterion examples here, or sorry, scoring in a sense, is we would, at a bare minimum, need to see data controllers and processors formally supportive. I think we'd need to see the ICB saying, yep, this is something we care about and we want to see happen. And again, driving a sense of collaboration here. What we're looking for are those projects that can say, it's not just in our specific geographical patch, but we've got a relationship with another unit in another part of London that is, again, willing to work with us on this, so that the collaboration exemplifies the benefits of doing this at a London scale, but in practical terms, including at least one other ICS area. We'd be looking to you to have had an explicit conversation with those teams in your area that are tasked formally with implementation support. So health innovation networks are a core part of thinking about route to impact, and we would be expecting strong conversations and support from health innovation networks to demonstrate that this is something that could be operationalized in practice, and practical and credible descriptions of how projects could link to particular elements of the London tech stack. That could be about having had initial conversations about things like fire messaging or interoperability back into other products as a way of at least testing the ability for insights to be turned into impact. I think that the sort of final element of this, and this is a sort of general catch-all, is just to make sure that proposals that come back are credible in terms of resourcing and timeline. So these are obviously tall orders in terms of what we're looking for. There is a sense here that we will adopt a practical sense of trying to understand what's feasible in the time, but we'd like you to sort of propose what you think is feasible. One other element I think here that is important to think about in terms of both the collaboration and commitment from partners and also the resourcing is that, you know, we will really be looking for those proposals that have got a coalition together that can demonstrate some matched resourcing, because we'll be able to go further and faster if you can already demonstrate that you've got partnerships either with existing research teams or research programs that are funded to do work, and or industry partners that are looking to do this with you. So that's a core element of being able to, I think, demonstrate that there is something credible that can be done within the resourcing and the timelines. I'm just going to quickly give you a sense of the process, and this is, you know, in a sense, subject to absolute confirmation, but the timelines on the left really would be to say that we are looking for submissions back using the template that's available on the website by the end of July. In terms of the process from that point, using a slightly more elaborated version of the framework I've just talked through, the core sort of program team will do an eligibility filter so that we can present a long list to system colleagues from ICBs, that would be the CIOs, the CCIOs, a section of CMOs, to do some shortlisting. Shortlisting getting down to then expect sort of fewer than 10 proposals to be reviewed by the final selection panel, which would be a lay member from our independent information access group, as well as exec level leadership from the ICBs, the regions, and universities. So really sort of keen that we have a mixture of our senior leaders across London making decisions about the proposals that come forward. And then we would get into, for those that are sort of the preferred selected bids, we would take them through a process with our IIAG, the Independent Information Access Group, and the local data access groups to make sure that we had supported those bids to have data access approval before we would finalise and award the grant funding. Our intention would be to do that by the end of September. I'm gonna pause here and just Kavitha, if there are things from that in particular you just want me to circle back round for your slides, I'd be happy to put those back up. But keen that we also go to questions for colleagues on the call.
Because I talked about it, I'll just go through the slides if you can find it, Mark, or shall I put it up?
Yeah. If you have it to hand and can put it up, I think that'll give you more control.
Just go back the slides. Thanks everyone for your patience. So, yeah, I did talk about the data. So this is the spec I mentioned. So for primary care data and acute data, and I know there was a comment in the chat, I'll cover that as well. I've not ignored it. So I thought I'll give you a bit of an understanding of the latency of the data flow plus how much data is there as well together, which might be helpful. So primary care data that will be available will be a daily data flow with a 1 to 2 day lag. So for example, today, 20th, we will have like the data as of the 18th. So that's really how it would work. And if you go into the links of, the health data gateway, you'll be able to see the rough spec of, what data points will be there. And these are all the data sets, national data sets for acute. With mental health and community, I have actually given a spreadsheet because the gateway currently holds interim or a transition spec, which we will have whilst we are, moving into this final state. So when you access the environment, what is in these two specs is what you will see in the environment. To answer the question in the chat, how many years worth of data we will have? The acute mental health and community, we will have data from 2018 onwards. And anything before that, we will try, but the data quality will be a bit compromised. So we are not committing to having, data available before that. With primary care data, however, it goes back quite a long time. So the way the primary care data flows is you will have data from the point of a person getting registered with a general practice. So if, there's a person who's 45-year-old, has been registered with a general practice in London from the time they were born, we will have 45 years worth of data for that person. So that's how it works. So primary care will be the most richest. And as I said, you will be accessing the environment through a virtual desktop. So this is what it'll look like. And within the desktop, you will have a lot of icons. There are some shortcuts and, there are certain products there without shortcuts as well, but we have given, a list of everything you will have access to. And the Snowflake itself is the analytical and data warehousing tool, which can be accessed via a user interface called Snowsite. And you can also access Snowflake through a Visual Studio extension, which gives a bit more integrated sort of development, a view for those who are a bit more technical and you want to have a SQL type, setup. This is what is available. And as I said, the machine learning is available. The standard is small. And if you do want to expand to a higher spec, we can, but there will be cost involved in it, which is why the standard offer is small. And it will be discussed project by project with the requester so we can, evaluate the costs and work out, is it needed for a short period of time whilst you're doing heavy processing, or is it needed throughout the duration of the project and, work out the totality of the costs. And the Jupyter Notebook is also available and can be accessed through the environment to manage your Azure Machine Learning web service if you prefer to do it that way. RStudio, again, I know is commonly used by researchers, so we do have RStudio as an offer within the Azure Machine Learning. This allows you to work within R, and if you prefer that, then there is a range of R packages that's already available within the environment for you to use for your code. And if you want anything additional, you can make a request, no charge for requesting additional R packages. The same with Python. And if you want additional Python libraries, you can request no additional charge. And these are the two mailboxes I mentioned, which can be used to send inquiries. Because we already have some live projects running in a Northwest London environment. We have a Northwest London mailbox, but also a London mailbox. So please send your emails to both of these to get prompt response. But if you pick one also, no problem. We will respond to you. That's really what I said earlier, and I wanted to share the slides, but we will send this around after this call too.
Fantastic, thank you, Kavitha. So we've got time for some questions and discussion, and I'm trying to answer some in the chat as well. Just to repeat, we'll take all of the chat content and we'll put it into an FAQ and share around. But happy to, I mean, if anybody has a comment or question, indicate the usual way, and we'll work our way through.
Hi, Mike. Thanks so much for the presentation. I just put a few questions there, more around the scope of the funding that is available. I put quite a few questions, but whatever is available to answer would be really helpful. More around the sort of scope and eligibility criteria for the applications, the submissions, for the projects that we may want to put forward, including, the maximum length of the projects. I know you included some timelines, and just wondering if there is a sort of upper end to the length of the projects that will be submitted. Is there an upper end for the funding per project available to access this data? Also, is there any specific eligibility criteria from the lead applicants? Would this come from an NHS provider, an academic institution, a commercial company? Are there any limitations around there?
Right.
And then, yeah, sorry, there's a few questions there, but yeah, any
great
information will help.
Thanks for sticking them in the chat. I've put some answers in there, but let me just speak to them. I'll give others a chance to also think of any questions or comments. So we're looking for projects that can demonstrate some impact over 12 months from the award. So let's essentially say from sort of November, December, over the course of that calendar year 2026. I don't think that puts a limit on the timeline, but what it's saying is we would expect there to be a credible route to some impact in that period. I think the maximum funding from the programme would be £250,000 for a given project. That shouldn't be the limit of the resource, because the whole point of this is to try and crowd in match funding. So in a sense, the total resource available will be set by the limits of the consortium that you can bring together. But 250,000 is the upper limit per project for the programme funding. There'll be up to 3 projects that we anticipate to be funded. And in terms of eligibility criteria, our expectation is that this would be led by a London-based NHS or university lead, not an industry lead, but of course, we are looking for industry collaboration. So it's really important that we would want to encourage industry collaboration in the response. In terms of actually a template, we've created one. It's a great question. It's available on our website. If you click the link in the chat, that will take you through to our overall sort of news story. At the bottom of that page, there is additional information, including the bidding template.
Thanks so much.
Just picking up questions in the chat. Yes, straightforwardly and sort of unashamedly, we're only interested in projects that are going to demonstrate and enhance the capabilities of London SDE. We think there are lots of great projects that can do that. We would rely on you collectively to generate some of the ideas around that. But I think if you want to do other sorts of research, then this probably isn't the call for you, and there'll be other opportunities through different funding routes. Just in terms, because there was a very interesting question asked in the chat, I just want to bring it up. I think it was Philippa, which was asking about what's our definition of research. I think I want to sort of point to the Treasury and ESA definition. So very important, I think, for us here to be thinking about this across the innovation continuum. So we're not just talking about blue skies. I think really the focus here is on that translational research that can get into some type of early stage prototype, so that we can see some level of implementation. The definition that's given is, research covers any sort of creative work undertaken on a systematic basis that increases the stock of knowledge and use of this stock of knowledge for the purposes of discovering or developing new products, including improved versions of things that already exist, and more efficient processes or production. So I think we want to be quite liberal in the definition of research. We want to be quite rigid in saying the purpose of the research is to be applied in the system using the SDE as a route for that. I can see that Philippa is saying that's good news, so I'm pleased on that basis.
I think Mark, there's a couple more questions in the chat. I will help you a bit. So timelines for having London-wide data. We are saying it's end of the calendar year, right? So all the data spec that I talked about is London-wide data. Are you happy with that one? Yeah.
Right.
And then in terms of Elizabeth's question about digital pathology, what we said as the data availability within this pack is what will be available, Elizabeth, for this round of funding bid. We are not at this point in time going to have imaging data to support any projects, unfortunately. That is absolutely in the roadmap, and we will do it, possibility to come in the following years. But for now, it is coded data.
Yes, and just because I think I might have introduced some confusion there, and apologies. What I'm highlighting is that structured data from pathology, so not imaging, but structured data, is already available for North West London labs through the work that Kavita and team have done as part of the development of WSIC and Discover Now. So I'm sure we can share the spec of that. I think what I'm highlighting here is either use of that or understanding how you could source the same data from other pathology labs to do something in combination. That's an example of the sort of work that would utilize data that's there, but then actively enhance it so that we can have similar sorts of capabilities across other ICSs. There's an invitation here for you to think about those sorts of data sets. And I think I just wanted to highlight the pathology structured data as one that existed.
Yeah. And that's sort of like a similar answer, Gulam, to your question as well. The expectation is all of the research happens within London SDE. But, to Mark's point, say if there was another secure data environment who has got a lot of rich data, if you want to think of a project that enables the federation of the data with, what we already have in London SDE, then, we welcome that kind of project so that the data can be made available within the SDE and the actual project research is happening in the SDE. I think that's all the questions that, I can see in the chat, Mark. Oh, there is a comment about the timeline and 1 year being quite a short timeline.
Perfect. And so, yes, Anne, I think that probably indicates that this is a year to have some type of output that has some impact. Just in terms of the question says, will the environment remain available? Yes, and our hope here is that these are driver projects to establish an infrastructure that we hope is going to be available in perpetuity and will continue to develop. So the London Secure Data Environment is this is a plan to create an asset available to London and across the country for many years to come. The driver projects really are our way of ensuring that the development of that asset is directed by actual use cases rather than folks like Kavita and me dreaming up what we think will be useful. So we're inviting these very specifically to help us develop and showcase what a secure data environment can do. I can see that just a couple others coming up. One on rare diseases. Look, that would be rare diseases are a fantastic use case insofar as I think if you think that the data assets that are available or that you can bring in will help identify studies with sufficient power, because we've got large scale data, so you can identify signals from very small numbers, then that feels like a very good use case. I think, again, linked back to the point about the London vision and core priorities, the challenge back would be to say, are you selecting cohorts that are identified as priorities by the ICBs that you're working within? London has a very large sickle cell cohort, for example, and it's a significant regional priority because of the extreme needs that are encountered by that group. So as an example, just sort of yes to rare diseases, and also I think that the challenge still holds to demonstrate that that is linked to the London vision and the priorities. Let's have a little look. I'm going to take us some commentary. The idea that ICB priority lists are wide and diverse. Yes, and I think that's where the commitment to act on specific data sets and to assemble coalitions in the response that are going to be working on practical projects, I think is that's the task to set oneself. I can see that have all secondary sites contributed to the data in the London SDE? By secondary site, I think mean acute hospitals. What we're expecting is yes, in the first instance, that is through the commissioning data sets. These are the sort of structured episodic data sets that contain care setting, procedure, diagnostic information. Again, we'll share links that highlight the sort of data specificity around that, but we're looking for those from the sort of information that's sent to NHS England and the secondary use service, as an example. Kavitha, there's a question here specifically from Elizabeth about cancer data.
I was about to say that what you just said now is similar to the cancer question as well in the chat. So Elizabeth, because it'll be commissioning data set that will be available within the environment, it'll talk about patients who are undertaking cancer treatment within the acute setting. That's what you'll be able to see. So we're not going to have any bespoke cancer data set now being made available within the environment for the time being. So it's only like broad registry type data. Equally, we will know who are on the long-term condition cancer registry based on primary care data that's held as well.
Great. Any further sort of comments, questions? Lovely. Well, look, conscious that you'll all have busy days, and just reiterate core commitments that we'll take. So we will make this available as a recording. I think we're going to put it on a YouTube channel and make the link available to you through the One London website, which we can circulate back round. And in addition to that, we will put answers to these questions in a document together, and also put that onto the website so that all the information's in one place. As I say, as a sort of program director on this, I really recognise that what we're setting here is a tall order, and intentionally so. I think we're trying to do something that's genuinely going to revolutionise the way we turn innovation into impact on the ground, and we're really excited about the opportunity to work with many of you to make that happen. And this is a process, not the only process, to enable that. And as one of the questions asked earlier, is the environment only available during this? No, we're trying to set the scene for a fundamentally different way of doing research and innovation for the future. So we're looking forward to receiving really exciting bids. I hope today has been sufficient to give you a sense of what we're looking for, and to give you a sense of who to be going and talking to in order to generate the types of consortium response that's going to be really strong. If you have any follow-up questions, my details are on the flyer. It's and we'll put it on the other information, but do get in touch. I think I'd also encourage you to be just having conversations across the sort of core units of BRCs, ARCs, health innovation networks, to just make sure that there's a good deal of coordination amongst you, and obviously conversations then back into your sort of clinical and data leads at an ICB level, just to make sure that the proposals are strongly supported by those teams. That's probably enough from me. Kavitha, any sort of final reflections, thoughts from you?
No, I think that's it, really, Mark. You've covered everything. It is exciting to go on this journey. So hoping to see lots of interesting projects.
All right. Well, look, thanks everybody, and hope you have an enjoyable rest of the day.
Thanks all for joining.
Yeah.
Right.